So this is where I work here is not a children's hospital. Up the street is Rady Children's Hospital. They see 2 cases a day of marijuana poisoning. And they are seeing little kids, like 2 years old, getting to mommy's, gummy bear because it looks cute and tastes sweet, and they eat it and they end up in the ICU. There's been a 13-fold increase in children, babies, getting into candies. It's the #1 cause of pediatric poisoning in the United States is marijuana. And we've all heard of kids going to school and bringing some edibles and ending up in the emergency room. That's very sad because when you go to school, you want to be safe. You don't want to end up in the emergency room. It's dangerous in adults, and kids are more susceptible, right? Because it's a dose related, right? 10 milligrams when you weigh, 50 pounds is different than if you weigh, 150 pounds. So there is a dose response to that. So it makes kids more susceptible than adults. Well, there's a definition of what medicine really is. And as a physician who went to medical school and residency and have to take board exams every year, if I treated marijuana like people call it a medicine, I'd lose my license, right? If I need to give you amoxicillin antibiotic for your sore throat, I need to do a physical exam, I need to do vital signs, I need to check your history, make sure you don't have any drug interactions, allergies, and then I have to figure out, is the right medications for you, have it come from a pharmacy so I know what it is and doesn't have contaminants. Marijuana as medicine does not follow the standard of care of anything related to what I described as medicine. So it's kind of a hijacked word, medicine, really for profit and for the industry, because it does not follow the standards that pharmacists, doctors, and nurses must follow for our medical license to be a license, to be a medicine. What I think parents need to know also is that this is not your mama's marijuana. This has been genetically modified ever since California legalized marijuana in 1997. We don't even sell that plant anymore. It's way more potent. People on marijuana behave like they're on methamphetamines, right? They're high, like the patient I described, running around naked in his underwear. I think the best way to deal with kids is to be honest. Not everybody who uses marijuana is going to get psychosis or schizophrenia, but it's a risk, right? Not everybody who smokes cigarettes is going to get lung cancer or emphysema, but it's a risk, right? You want to protect yourself. So we have the statistics, we have the science. I mean, we know that 30% of cases of schizophrenia could be eliminated if we didn't have men use marijuana from the ages 18 to 30. Young men are very susceptible to that more than other. Marijuana is a risk factor for psychosis. Psychosis means feeling of unreality. You feel that people are out to get you. You're hearing voices, seeing things that are not real, but they feel really real to you. So using marijuana is a risk factor for psychosis. If you continue using that psychosis can become permanent, and that's what schizophrenia is. So there's a 5-fold risk of developing schizophrenia for people who use marijuana on a regular daily dose. So you could eliminate that, and that's important for kids to know. The other thing for kids to know is that their brain is growing until you're 25 years old. You want to be as tall as you can, especially me. I'm really short. I would wish I could be a lot taller. But your brain is growing even after that, till you're 25, even 27 years old. So you don't want to stunt the growth of your height. You don't want to stunt the growth of your brain. You want to protect your brain. And the fact is that most kids are making the decision to protect their brain till they're 25 years old. People say, oh, well, everybody uses marijuana, everybody uses drugs. Well, that's not true. More kids are making the choice, the one choice, to protect their brain and not use nicotine, vaping, alcohol, or any drugs at least till you're 25 years old. 90% of people who have an addiction started before they were 18. So that's big. So I'm actually really happy that young people are making the choice, the smart choice, to protect their brain. You know what? It took us 100 years with tobacco to get to where we are, where society understands that. But 100 years ago, everybody was smoking. My favorite picture is the guy who's the head of the Cancer Association with a cigarette. It was, everybody did that, right? Soldiers got their cigarettes going off to war. And it took us a long time to fight a very powerful industry, big tobacco, to get to the truth. And it's really the same people now who are running big marijuana. And we're reliving history now with marijuana. Same thing. Nobody dies of one puff. And that's how it was. And I like to picture the pathologists who are looking at people's bodies and seeing all these black lungs, and they're saying, hey, well, maybe it's just pollution out there. Nobody died of tobacco. That's the same thing. So I like to learn from history. And I really see the same thing kind of happening with marijuana. Like all these cases of schizophrenia and psychosis, and our emergency departments are full of mental health crises. But hey, it's not weed, it's just weed. We got to pay attention. Vaping can have a lot more nicotine than tobacco cigarettes. And we've seen, sadly, young people end up in the ICU from vaping. And that's from nicotine, and it could also be when they're putting marijuana or other chemicals in the vape. You don't always know what you're buying, right? The Juuls, the commercial Juuls, if that's what you're buying straight from the store, should have nicotine with flavorings that they also sell that makes it attractive to kids. It's really sad because we did so good getting society to stop smoking, and smoking's bad for you, it's not healthy, and then overnight we created something that's much worse that people are using. And it's addicting, so if people are vaping and they want to quit, there are programs. There's a great program by the state of California called Quit the Hit to help people stop vaping, just like we have programs to stop with tobacco.